Hi, it's Patrick Hutzel here again from Intensive Care Hotline, and in this week I want to answer a question that I get all the time from our readers, and the question is: how long can a breathing tube or an endotracheal tube stay in? A very common question that I get asked quite frequently from family members or friends of critically ill patients in intensive care is how long a breathing tube or an endotracheal tube can stay in when their loved one is mechanically ventilated in intensive care. So let's get right into it. Now, as a rule of thumb, a breathing tube or an endotracheal tube is usually staying in your loved one's throat or larynx for up to 2 weeks at the most, unless there are special and rare circumstances. I'll come to those special and rare circumstances later. The reality is that most critically ill patients in intensive care only require mechanical ventilation with ventilators or a breathing machine with a breathing tube for a limited period of time. Most mechanically ventilated patients in intensive care only require ventilation with a breathing tube for a few days at the most. The most common reasons for mechanical ventilation with a breathing tube in intensive care is post-surgery trauma, lung diseases such as pneumonia, adult respiratory distress syndrome, also known as lung failure, COPD, acute severe asthma, and also other admissions such as pancreatitis, burns, heart attack, or a cardiac arrest situation. The list is not exhaustive, and I only mentioned the most common scenarios in intensive care where mechanical ventilation with a breathing tube or an endotracheal tube is necessary. But because the question that I get asked quite frequently is how long can a breathing tube or an endotracheal tube stay in your loved one's throat, the answer is that it can almost stay in indefinitely. That's certainly not a desired goal, and again, normally it doesn't happen. Normally I would say that up to 2 weeks is the longest that I have seen a breathing tube being in somebody's throat. Usually what happens if your critically ill loved one is requiring ongoing mechanical ventilation and it's foreseeable that extubation or removal of the breathing tube is not on the horizon due to the critical illness of your loved one, normally a formation of a tracheostomy is the next step. A tracheostomy is another tube that is permanently or temporarily inserted into your loved one's neck, into the windpipe, going directly into the lungs. This tracheostomy tube is making it a lot easier for your loved one to be mechanically ventilated as the tube is no longer in the mouth. It's also easier to be weaned off the ventilator, as ventilation with a tracheostomy doesn't require a huge amount of sedation compared to the amount of sedation needed for when your loved one requires the breathing tube through the mouth. Now, your loved one can also be taken off the ventilator intermittently or permanently to find out how well your loved one is breathing without the ventilator. And generally, looking after a tracheostomy is so much easier for your loved one to tolerate as well, and it's also less risky than a breathing tube or an endotracheal tube. Furthermore, a tracheostomy tube can stay in infinitely, and in fact some people have a lifelong tracheostomy tube in place and they can live with it independently. I hope that answers this common question that I get all the time, and if you have any further questions, please send me your question to support@intensivecarehotline.com. Also, if you want to learn quickly how you can take control, have real power and influence decision making while your loved one is critically ill in intensive care, enter your email below and get your free instant impact report so that you can learn instantly what you need to do in order to take control of the situation. Furthermore, you get 4 more free reports, like 6 questions you need to ask the most senior doctor in intensive care, the 7 most frequently asked questions while your loved one is critically ill in intensive care, 10 things you didn't know doctors and nurses are talking about while your loved one is critically ill in intensive care, and 9 myths of being a critically ill patient in intensive care. Have a good day, and I'll see you next week in another update. Thank you.